Evaluating combined effect of oral premedication with ibuprofen and dexamethasone and success of inferior alveolar nerve block in mandibular molars with symptomatic irreversible pulpitis. A prospective double-blind randomized clinical trial by Mohit and Kumar in 2021. Pulpal inflammation often has been cited as one of the main causes of inferior alveolar nerve blocks in symptomatic irreversible pulpitis. In irreversible pulpitis, breakdown of damaged cell membrane and release of arachidonic acid occur. The arachidonic acid is acted on by cyclooxygenase and lipooxygenase enzyme and gets converted into biologically active prostaglandins and leukotrienes, respectively. The greater the level of prostaglandin can affect the tetrodotoxin resistance receptor and slack off the nerve response to this anesthetic solution. So the aim of this study was to determine the combined effect of preoperative ibuprofen and dexamethasone, which is glucocorticoid, on the success rate of inferior alveolar nerve block in cases of mandibular molar with symptomatic irreversible pulpitis. All included patients were experiencing moderate to severe pain in mandibular molars and had a normal periapical radiographic appearance. They were in good health and had not taken any analgesics for the last 12 hours before the enrollment in the study. The clinical diagnosis of symptomatic irreversible pulpitis was confirmed with electrical pulp test and cold test. All patients recruited in the study had given 4 readings for pain during the entire procedure, and the patients were randomly allocated into different 4 groups, receiving the following: placebo, 0.5 mg dexamethasone, 800 mg ibuprofen, and combination between 0.5 dexamethasone and 800 mg ibuprofen. After 1 hour of the premedication, all patients received standard inferior alveolar nerve block. Every patient was questioned for lip numbness. If deep lip numbness was not reported by 15 minutes, the patient is excluded from the study. After access cavity and instrumentation, the patients were instructed to raise their hand if they felt any pain during the endodontic procedure. If the pain was moderate to severe, the procedure was immediately stopped and the patient rated their pain. Success was defined as no pain or mild, where moderate to severe pain anytime during the procedure was considered as failure. As for the result, the overall success rate was 75% for the placebo group, 71% for the dexamethasone group, 85% for the ibuprofen group, and 95% for the combined group. In this study, 15 patients reported moderate to severe pain during the procedure, and they were considered failure. So the result of this study demonstrate that the combination of ibuprofen and dexamethasone significantly improved the success rate of inferior alveolar nerve block compared with all other groups. Dexamethasone acted by inhibiting the formation of arachidonic acid from neutrophils and macrophages cell membrane phospholipids, thus blocking the COX and lipooxygenase pathway and the respective synthesis of prostaglandin and leukotrienes, where ibuprofen worked more downstream in the inflammatory cascade and inhibit COX enzyme, thus preventing the synthesis of prostaglandin. In this manner, synthesis of all inflammatory mediator was prevented, which resulted in significant improved aesthetic success. So within the limitation of this study, it can be concluded that the combination of preoperative ibuprofen and dexamethasone significantly improved the success rate of inferior alveolar and mandibular molars with symptomatic irreversible pulpitis.